I do live in this country, the USA, and my family has had 2 foreign exchange students living with us for 1 year each from Italy and France. My little sister went to school in France for 2 6-month terms. My mom broke her arm and did not want to go to the emergency room because she could not afford it. We took her there anyway. When she got home, our French exchange student asked when the maid was going to arrive to clean the house. We all laughed at first and then listened to what she had to say. When our exchange student's mom gave birth to her and her brothers, she got paid time off with maid service several times each week. We explained to her that we don't get that service here, and on top of that, most are stuck with the $5,000 to $30,000 bill from the ER, on top of them not being able to work, all because of one accident. Our exchange student was in shock. If you have an emergency in the U.S., the doctors are required to treat you in the ER. That is not saying that they're required to give you the best of care. After the emergency is over, they give you a note telling you to follow up with your doctor, or in my mom's case, get physical therapy for her arm. The government will not cover this, nor will it cover cancer treatments or life-saving prescriptions. If you have a child, you get an indigent care so that the government will foot the bill for the emergency room only. If you do not have children, you will get stuck with the bill, and the doctors will try to collect multiple times a day until the 4 years of harassment are over. In Texas, collectors can only harass you for 4 years from the date of the last payment. After 7 years, it will be off of your credit report. This was the route I saw most of the people in my hometown using, who can afford a $30,000 plus medical bill. Most people earning the average minimum wage cannot. Even at $8 an hour working a regular job, they would only be making a little over $16,000 a year. Add a kid into the mix, and now they're having to send over a third of their monthly income to the cheapest daycare they can find. That leaves just under $1,000 a month for all the other expenses. The majority of people live like this every day. You'd think we'd be able to take care of our own people with the amount of money that we are pouring into other countries and the war. Heaven forbid we actually allow these checkout workers and secretaries to retire at a reasonable time. Even if they are one of the small percentage of people lucky enough to retire before they die, how would they be able to afford the medicines and health care? You can't go into an emergency room for cancer, and there is not a government plan to get treatment and preventative care for these things. While my little sister was in France on a student visa, she got sick with flu-like symptoms. She was just going to wait it out for a couple of weeks, because that is what we do here in the U.S. when we can't afford the meds and hospital care we need. Then one of her French friends took her to the hospital and pharmacy there. She paid nothing. An American in France paid nothing for their health care. That bill here could have easily been $100 or more. What college student has the money to get sick? She could not even work in that country, so they gave her money to live off of as a student. When I traveled to Greece in 2005, we hung out with a Canadian that had 8 open heart surgeries before he was 20 and did not have to pay a penny for them. He showed us the scars on his chest. Some people who have been brainwashed by politicians and the media that were bought out by insurance and pharmaceutical companies may say socialized medical service is slow and the government gets to decide what doctor you can use or whether you can go to the doctor at all. I spoke with another Canadian over the phone after hearing these statements and watching Sicko. He said everything in the documentary about Canada and Canadians was pretty accurate. Their waiting time was shorter than an hour, and they got to go to whichever clinic they wanted to and were seen regardless of their complaint. He did mention that the people that came in that were having heart attacks and other life-threatening conditions were seen first, and broken legs were set before ingrown nails were fixed, however. On top of the fact that the U.S. already has great models for the socialist system available, France's model being the best, Americans are starting at the ground level. We get to be a part of and choose what we want and don't want in our system. If you don't want to take the free care, I'm sure that the insurance companies will be happy to still take your money and send you to the same hospitals. But for the majority of uninsured, socialized medicine would be the greatest burden lifted. But what about health insurance, you might say? If you're lucky enough to qualify at all, the prices are not that great. I own my own company. My insurance would be upward of $500 each month. I am lucky enough to be married to a guy who has a great job with one of the best medical insurances around, Blue Cross. I'm a vegetarian, non-smoker, non-drinker, 26-year-old white woman with no history of anything bad, and I take vitamins every day. We have to pay $300 each month just to cover me on his plan. Then we have to pay $15 copays for every single doctor visit. My birth control pills are $40 each month. Before Bush came into office, I was able to pay less at Planned Parenthood. To have a child on my medical insurance at the hospital, it would cost over $1,000 with the insurance. My husband's company is also paying part of the insurance as well. My mother brought up that if we had socialized medicine here, that we would have to pay more in taxes. We are already paying $300 a month for medical coverage. If we were taxed for medical, it could not be more than what we are paying for insurance, copays, prescriptions, plus whatever his company is paying as well. We would also not be slammed with the taxes all of a sudden. It would happen slowly over the course of a 10-year period, and it would happen to everyone, so it's not like some people would suffer more than others. On a side note, our Italian exchange student started college once she got back to Italy. She only pays $3,000 a year for a large, hard-to-get-into fashion college in Rome. I asked her why it was so cheap, and she informed me that she does not actually pay for her tuition, just the taxes on the tuition. Then I told her about the student loans that I had to take out just to go to my schools. At that time, I was up to $30,000. Now I have a piece of paper worth $49,000. The price of tuition has almost doubled from the time that I started college, since someone in government decided to take the cap off that was on the college tuitions. I could not afford to go to the college I really wanted to go to because of the cost. So yes, I am from this country, the U.S. I was born in California and raised in Texas. And yes, I have looked into other countries and how they are running things, and I have heard firsthand about their other situations and how they are different from here and in other European countries and Canada. I would move to Canada tomorrow if it were warmer. Even I feel sorry for the people living in the United States, myself included, and my family. The U.S. thinks they are great. You can tell a lot about a country by how they treat their poor.